Welcome back to Voice of the Valley. Today we are here with Dariah Ellis. She is the founder of Good Anatomy Medical Aesthetics. How are you doing today, Dariah?
I'm doing good.
How's
How
it
are
going?
you guys? I'm
Good.
Really good. So before we go into your company, how was it like growing up in the Lehigh Valley? What is your story?
Oh, wow. Okay. So we can start with, I came from Philly from, I think it was about 16, 17 years old. So it was like your 11th grade year. I went to Catholic school my whole life. So transitioning into a public school setting was a lot. It was intense. It was a clear distinction. But I think the hardest part was, I guess, assimilating into this suburbia society, and it was not fun. Like, let's start off with just the teachers. I was the only Black kid in all my classes because I was coming from Catholic school. So I was doing honor programs, A&P programs. So that means I would be starting in honors and A&P courses right away at Emmaus High School. So being the only Black girl in these settings, I'm going to say picked on. My teacher would say, "Oh, wow, you speak so well." That's microaggression. Every word I say, she will highlight. "Well, how do you know that?" I'm getting the answers right like everyone else. Why is it astonishing that I wouldn't know these answers as well? So it was that part. And just the culture itself. And I wondered, like, I would see other Black students, Puerto Rican, ethnic students, and none of them would be in my classes. Where are they?
Why do you think that is? Why do you think, I guess you were sort of picked on or that the suburban life was different for you? Why do you think that is?
Not to sound like conspiracy theorists, but I think that a lot of the kids that were already in the East Penn School District was already labeled to go into remedial classes, to go into classes for learning development. Why weren't those students in any of the classes that I was in? It's no way that I was the only person that knew the same material or had the same experience. If not, they had better experiences at the East Penn School District than I would have had in Philadelphia School District. So I think there might be some systems at play there that by the time they get to high school, they are not qualifying for honor or A&P courses because they've already been weeded out during elementary school to say that they have learning disabilities.
Mm-hmm. And would you say that you love to learn and that's something that you loved to do when you were growing up? So when we kind of got to high school, you're like, well, why am I being treated differently for this?
Yeah, that's a good question. I am a nerd. So while people were maybe into boys or fashion, I was going through book series, like within the night. What was it? I want to say the 50 Shades of Grey. I had no business reading that. I read that all in one night, I'm talking about 24-hour period. I never put the book down. So it just gives you an idea of puzzles. I love 500 to 1,000 piece puzzles at the young age of like 8, 9, and 10. Those were my hobbies. And that kind of contradicts what most girls are doing around that age group.
Mm-hmm. That's so interesting. So flash forward, now you are graduating high school. What is that experience like and leading up to college? Did you go to college?
Yes, I went to college.
Okay.
So graduating high school was a lot. There was a lot of different things at play. So I applied to be a doctor. And this is like my thorn in my side story. So I'm glad you brought it up because it kind of feels like therapy. But I did everything that you would do to apply for college. I sat for my SAT boards. I worked at, that would be CVS on Crocs Road. I paid for all the applications. You know the process it goes through to apply for a college. Submitted my letters. I received back from Drexel and from Widener. Drexel gave me a half scholarship to do their med or pre-med program, and Widener gave me additional half scholarship, but a little bit less. So basically, I would have to go in and maybe prove myself to at least qualify for the full scholarship. And this is going off of would be the only person that would graduate from college in my household. No one knew that you sat for SAT prep courses. That wasn't the type of family structure I had. So I did all these things on my own. This would be graduation day. My mother, as we're driving to go out to eat, she asked me, well, what are you going to do? I said, well, I got those acceptance letters. I'm going off to college to go be a doctor. I just need $500 in order to hold my place for your room and board. I'm not giving you that. You're not ready to leave. And that was like the defining moment of my life realistically, because nursing was never something that I even aspired to do. But now that I'm older and I'm understanding the idea of life will redirect you to the journey that you need to go, I understand why I had to go through that. Initially, I was distraught because now I'm seeing like some of my cousins, they're graduating with their pre-med, they're going off to grad school, and I'm completing courses at L-Tri-C. And that's not even a picture of the idea of who I was going to be as an adult. So I did finish up at L-Tri-C. I did the LPN program, did that independently, paid for all my courses. Then I did their bridge for their RN. And then I found, this is about like 2 years into me being a registered nurse, I found a program that allows you to do all of your coursework online, but then your preceptorship, you will have to find your own preceptors. And it was a 2-year program. So I had an associate's as a registered nurse. And I moved from associate's and jumped to a master's within that 2 to 3 year time frame. Not easy, not easy at all. But I'm so fortunate that that type of, I guess you would say that type of mental clarity to say like, hey, I could have just stopped and said, okay, well, I guess I am only as good as LPN. But I said, no, I wanted to be a doctor. I wanted to be a provider, and I always wanted to be those things. But now I get to combine being a provider, but also with my nursing background, because being a nurse is such a holistic experience. You're really going into their lives, their lifestyle. You're an advocate for someone you don't even know. So I think that if we, not degrade what's better, a doctor or a nurse, but nurses, we rock.
So studying, right? You said you're a nerd at heart, which means you just love the books. You love to be in the environment. While you were studying in college, how did your day-to-day life look like? Were you really studying for 14 hours, like the rumors say on social media and stuff like that?
Absolutely not. That is impossible. And also we're dealing with, I'm living on my own at this point as a 20-year-old, 21. That's when I became a nurse. And you're not that studious. It's impossible. There's so many, you're growing mentally, life experiences. Now I'm dating. Now I'm seeing the real world. There is no authority at hand. And on top of that, I'm financially stable. So to say then that I'm going to, when I did the bridge program, just lock in on books, I did not. But what I did do is showed up no matter what. And I think that's consistency. So you can have the motivation to achieve something, but you have to be consistent. So whether I was hungover, I was there in class. I made sure I stayed consistent no matter the season that I was in.
And so fast forwarding, after you graduated, how long were you a nurse for before you opened Good Anatomy?
That would be 10 years.
10 years?
10 years as a nurse. So throughout that would be years as an LPN. And what would that be? 3 years as a registered nurse. And then now we moved on to, no, that is the wrong math. What math am I doing here? Wow, I've been a nurse for 10 years. Hold on, I'm having a revelation right now. What have I been doing this whole time? I worked as an LPN. That was 2016. Then I transitioned over to RN, graduated in 2018. And then I graduated as a nurse practitioner in 2024. You guys are good at math?
Yeah.
Okay. I hope you follow that.
Yeah, I got you. So you are a nurse practitioner.
So I'm a nurse practitioner.
Wow. And what is that, 6 years? School?
No, it was a 2-year program. It took me 3 years. So I started, yes. So that lets you know not everything is going to work out smoothly. I started the program when my son was 6 months old. Just because, one, I knew I couldn't just go back to bedside nursing and that be the end goal, just because I want to be available to him. I want a work-life balance. Working 16-hour shifts, working 12-hour shifts was not the life I envisioned as a mother. So I knew I needed to have a game plan, whether it had to happen immediately or later down the line. I knew I need to plant those seeds. So I started when he was 6 months old, and it was supposed to be a 2-year program, meaning that he should have been 2 years old by the time I graduated. He was 3, kind of messed up my little photo op, but it's okay. So I would say that, what was the question? I forgot.
Well,
I'm losing my mind.
We'll get into, it was just, what were you doing during that timeline?
Being a mother.
Before you opened Good Anatomy?
I was being a mother. I was working as a wound specialist. So that's a form of like skin rejuvenation in itself, performing procedures at the bedside. So basically I was looking at the worst case scenarios of someone's skin and also disease processes. Because a lot of times we do know that the skin is the largest organ of the body. And when something shows up on the skin, it's giving you an indication that something is happening underneath that. So this is why when I do my assessments with my patients that come to my medical practice, I want to know everything about you. I want to know your eating habits, your sleeping habits, your stress levels, because this is going to play a role on the results you're actually going to receive. So even if you're coming in for skin rejuvenation, wound care, and even down to weight loss, I need to know these things about your background, your health background in itself. So branching off into like medical aesthetics from the element of wound care to now beautifying, in a sense, it's kind of just the same line, just on different spectrums. So
when was the turning point? Like you wanted to stop doing what you were doing, and then you wanted to open your practice?
So like I said before, I always saw myself in different room settings, if that makes sense. So I envision myself as a provider, as a doctor. I didn't envision myself working for someone else's company for long term. I enjoyed the experience of skincare and wound care, but I want the authority over the patients that I see, who I'm going to see, and kind of the care that I want to provide. So my turning point when I decided I wanted to transition to medical aesthetics was, I like the feeling of seeing something improve, but I would like to see it on the element of like someone maybe my age or maybe a little bit younger who don't face as severe chronic health conditions. Because when we are seeing these patients with wound care, they have stroke history, high blood pressure, diabetes, they're living below the poverty line. I just know I wanted to see a different demographic of patients, but also still ensuring that I am utilizing my nursing background, my healing background in that same,
That's great. So what was the hardest part of opening your company in the first year?
The hardest part was committing to myself and knowing that I can do this. When you have a vision, it's so easy to say, like the voice of the valley, this was just a vision. So you say, oh, I would love to do a podcast one day, interview people, but actually putting action towards that vision plan would be the hardest part, because there's always going to be those levels of insecurities, those levels of anxieties, those, what if this doesn't work out? What if it does work out even better than you can even imagine? Mm-hmm. So the hardest part was changing that thought process of, what if this doesn't work out, to what if this works out beautifully?
Gotcha. And was there anyone or that helped you think of the name, or did you think of the name, and what does it mean?
So no one helped me think of the name. A lot of it came with like when I think of like marketing, because this isn't my first business. Mm-hmm. I don't know if I told you guys.
No,
that.
What other businesses did you have before this?
So my first business, I was 21 at the time. I started a home care company in Philadelphia called Ellis Angels Home Care. So that's your non-medical care needs. I'm sure you guys have seen them. plenty of times. It's like that was like the hottest thing to do if you wanted to be a business owner and you had some type of medical background. So I started at 21. It was so difficult. It was so difficult, from being everything from the accountant, the manager, the the hiring manager in itself, the trainer, and also coordinating, marketing. It was a lot. And I made nothing for all the work that I put in. And maybe I wasn't at the age to run a business. That would be like my hindsight. I wasn't prepared. But now that I'm here in this space, I'm fully prepared because I had that experience.
That's what it's about, experience.
Yes.
So what other businesses? That was
and then I did an e-commerce store called Plato's Kids, which worked out beautifully. So this involved a lot of social media marketing, advertisement, coordinating, drop shipping. Loved it until I started getting orders that will be satisfied, and then they will write they never received their order. And boy, did that crush my spirit. And I just threw the towel in, because it didn't happen just, the one order did that. I don't know whether someone figured out a loophole to order from my website and they could just sit and return. I'm not too sure, but that definitely was another blow, so to speak. So it'll be my second business. It'll be my third business. And now that I think about it, it's encompassing two of those things I had experienced. Mm-hmm. One, healthcare setting, marketing in the healthcare world, and two, marketing online. And now I feel like I'm flourishing because I've had those experiences.
So going deeper into your practice, do you now, would you say, focus more on health or beauty?
I would say they're a balancing act.
They're balancing, okay.
Yes. So when we're thinking about medical aesthetics, we're thinking of luxury. We're thinking of, this isn't a necessity, but it is. I think with good anatomy, I know with good anatomy, the impact that we're going to have on the medical industry or the medical aesthetics industry is that we're going to merge wellness with medical aesthetics. Because when you look at it from this perspective, you can't have, it's a flip of two coins. You can't have both. You can't eat like crap, never sleep, never hydrate, and then expect to have glowing, radiant skin. Mm-hmm. And vice versa. You can't put or makeup on, never wash your skin, never take care of yourself on the outside, and expect that you're going to choose habits that are going to help your insides. So it's a mind-body experience when I'm thinking about good anatomy. We're fixing things that you're seeing on the outside, but also addressing some of those underlying issues of why you're seeing these imperfections. So are you not drinking? Are you not sleeping? Are you overweight? So it's a wellness approach. It's not just beauty and it's not just health. We are combining both.
Mm-hmm. My mother was an esthetician and she was focused more on beauty. So she did like microdermabrasions, mm-hmm. facials, eyebrows, like all that type of stuff, right?
Yeah.
But I never knew she was in the health part as well, because she might have been as well. She might have been doing some things there.
Well, I think you're taught as an esthetician, when you're giving these people these procedures, you do have to give them some, quid pro information, like, make sure you stay upright, make sure you stay away from harsh sunlight, make sure you hydrate. But are we really reinforcing it so that they can have the best outcomes? Or are we reinforcing it just because we want their health to improve overall? And I think that's a difference, because I am a nurse practitioner. I'm not just looking at it from a just beautifying procedure. I'm looking at it as a whole body, improvement. Because I had a patient, and it kind of touched my heart a lot, was when she first came to me, she was expressing like, I just look tired. And she did. She, had the under eye bag, skin is very dull. And then once we finished her procedures and she looked at herself, she cried. She cried in my chair. And she just says, I don't know. Like, I'm looking at myself and I feel ready for the world. Like, I feel excited. And I'm like, that's what happens when we are seeing something from the outside in the mirror, it kind of reinforces our spirit. So you're seeing tired and overwhelmed in the mirror, you're going to show up tired and overwhelmed in life. If we see glowing and refreshed in the mirror, you're going to show up glowing and bouncing and excited to do things. So it is a whole person approach for sure.
So would you say that's the main goal for every client that comes in, to kind of go over not just their beauty, but also like you said the full body?
Yeah, the whole body experience is a whole person care model. That's like your nursing 101. But that is always going to be the agenda when a patient comes to me and comes to Good Anatomy, is that we're just not doing procedures that on the outside. We're fixing you from the inside out as well. We want you to show up in the world excited. We want you to feel like you're restored wholly and not just visibly, because that's a mental health aspect.
That's huge, because not every med spa does that.
Not any med spas I've researched have done that. Realistically, no. I don't want to say it's a money grab, but it is. And that's not our focus here. I truly believe that this is going to change the way we look at medical aesthetics, because it is a healthcare field, realistically. And I think we've kind of turned it into just a beauty field. And that's not what medical aesthetics is. We're treating chronic conditions like TMJ, migraines. We're fixing, chronic scarring, whether you had any type of traumatic injuries. So it goes beyond that. And we need to go back to what the medical aesthetics field is. It is a specialty. It is not a beautifying agency.
So you said you fix scarring, and what else?
Scar tissue, TMJ. That's if you grind your jaws, it causes like a nerve pain, and also chronic migraines.
Could you give kind of like the process on how you would help fix those?
That's a hard question. We'll skip that one for now.
Okay.
Yeah, that's like something I would rather do like in the format of a podcast with we're going over procedures.
Like a visual?
Yeah.
I got you. That makes sense. So how do you decide on what a client should get versus what they would want? Like, do you ever have a client come in and be like, hey, I want this? And you're like, no. I think you would be better with this.
That's a good question. So that differentiates a injector from a provider. An injector is just going to give you what you want. A provider is going to help you determine the best treatment plan for you individually. And I'm not just an injector. We need to have these hard conversations. And also, I will say no, because I'm a provider. I'm your advocate. I'm not going to do anything that's going to cause you harm, that's not going to be within the best interest, or that is evidence-based. So a lot of women, I know you've seen these botched photos or videos of people, and they have what you call like the duck lips. And there was a provider that decided that they weren't going to tell this person no. I'm going to tell you no. And I have to be okay with that, because it is my practice. But also, you should feel safe knowing that I have your best interests at heart.
So what are some of the biggest mistakes besides the duck lips that you see with Botox and filler?
A common mistake where people think it's a major concern would be when you're getting neuromodulators, which is your Botox, is you'll see an eyelid drop or eyebrow ptosis, what we would call it, or eyelash ptosis. That's the most common mistake, but the reality is sometimes it's not preventable. It's not a preventable mistake, meaning that the anatomy of everyone is different. And if that injector injects in an area that would normally lie somewhere differently anatomically on another person, on you, it could cause a eyelid ptosis. It's not an emergency. It will wear off and it can happen. But some of the emergencies that I have noticed is also your vascular occlusions. And that's because you're going to an experienced injector who, again, is not aware of anatomy whatsoever, doesn't understand where your vessels lie, doesn't understand, the risk factors of putting filler, how much to put in a certain area. So those complications do exist. But as long as you're going to a provider who understands anatomy, is knowledgeable and experienced, and also knows how to do emergency dissolving agent right on hand. You need to have a protocol, because if you don't have a protocol for any of these potential side effects, then you're in bad shape.
So some of the side effects can happen right away while they're in the chair?
Yes, the vascular occlusion can happen. So you'll see, and I do post a lot of my videos when I'm providing the fillers, I am also assessing the area that I treated. Maybe it was like 5 or 10 minutes ago. So I'll press the area, check for any blanching, check for any pain, coolness, because we can catch these things before you even leave, the chair. And once we catch those things, we can dissolve them and then go on about, the procedure.
How about the eyelid thing? How long does that take to wear off typically?
That can be 6 to 8 weeks.
Oh,
now,
wow.
Too bad.
It's not too bad, but I can see how that would be disturbing for someone who went in thinking that they were going to get one procedure and end up with, kind of like a wonky eye or asymmetry that is clearly noticeable. So what you would do is probably inject the other side so it matches. Will that solve it? No, but I think it would be better just to let it wear off in the 6 to 8 week time period. And also knowing that we did do your full documentation of assessment of where we injected you. So we know, hey, when we inject, this far out on your corrugators, you are more than likely to drop. So we know not to inject you there moving forward.
What would you say to someone that is kind of nervous to try injectables?
So I'm not really in the business of convincing you to do something that's, one, not in your best interest. So, but also not something that you see yourself wanting. A person that's coming to Good Anatomy, they already have committed to receiving some level of injectables or some level of skincare repair. So those nerves of maybe you're more nervous to have a needle put into your face, I get that.
That's me.
Yeah,
That's me.
listen,
Right
and I get that. But if you're also unsure if injectables are right for you, I would encourage you to do further research before you decide to come in and get injectables. Because yes, there are people who religiously get them, and then there are people who say, hey, I've seen these results on, let's say, Kim Kardashian. Can you do the same? Understand that you're going to be different, and understand that we're not going to have the same outcome each patient. So it's not really let's get you on the injectable bandwagon. It's more so, what is it that you are looking to improve upon? And we need to have that discussion. If it's a realistic goal, or if I need to send you to therapy. Body dysmorphia is a thing.
So what are some of the fun things about your job? What's something fun that you do?
Fun? Okay, so I have these cute little, can I show it on camera?
Yeah, go ahead.
Okay. So this is what I say is my fun thing, and it kind of speaks to who I am. So I have these sweatshirts that I myself wear daily, almost. It has the Good Anatomy logo. But what's different about these is these little reminders on the sleeve. And it says, you deserve everything good that's coming your way.
Pull it up a little bit. Okay.
Little reminders on the sleeve.
You deserve everything good that's coming your way.
Yes. So you see this. This is positioned where it's constantly in eyesight of you throughout your day. And I'm one of those advocates of how we talk to ourselves, and our mind kind of dictates our habits.
Do you believe in the butterfly effect?
What is the butterfly effect?
So it's like little small changes lead to a huge outcome.
I would say yes then. That's consistency. That's basically what you define, the butterfly effect. So yes, but also I believe in the fact that if we don't keep things around us in our subconscious that is a reflection of our conscious, then we're never going to have any level of improvement. We're never going to reach those goals that, we want to achieve. So these are those kind of subconscious reminders. So whether you're reading it directly, your subconscious is reading it. You're saying things like, I deserve this. Today's going to be a good day. Everything I want wants me to, even though your conscious isn't saying that. So it's pushing you throughout your day to do better, to be better. So that's like the little fun thing that I do with my patients. And I like to give these away to people as gifts.
So all clients get those?
Okay. Now we're running a business here, Joe.
I was just wondering.
So I will say I do have these for sale in the actual office, but if you spend a certain amount, you do get, whether it's a shirt, my GLP-1 patients receive their workout shirt. Oh, can we show?
Oh, I love that shirt.
That's great.
Okay.
So you do prescribe the GLP-1s?
I do
Like
prescribe the
semaglutide?
GLP-1s, the semaglutide, the tirzepatide. That's medicine. Like I said, medical aesthetics is a specialty. And we're moving out of just beautifying. That's wellness. That's a peptide. Peptides are the biggest thing right now because we know that there are short chain amino acids that basically send messengers to our cells to whether repair your skin, produce more collagen, help you feel fuller longer, help your insulin resistance. So I do the GLP-1s because I understand how weight affects a person. They say, losing weight or decreasing your BMI decreases your risk for heart disease by 30 to 40%.
Yeah, because does it decrease the brown fat around your organs and stuff like that as well?
Oh, you know your GLP-1s. So yes.
So I used to sell those as well.
Okay, yes.
I do peptides as well. I do BPC 157, Sermorelin, and all those. I tore my ACL, so.
Okay, so you're fully knowledgeable.
Yeah.
And that's wellness. But also that's what a lot of medical aesthetic practices are providing, but not really understanding the value of it. Because if we're treating you from the inside out, we're also helping you get the best results. If you're on a medical skincare regimen, you're getting microneedling, filler. We know that hyaluronic acid is a molecule. It absorbs 1,000 times its water weight. So that's what's giving our plumpiness to our skin. So we have to incorporate wellness when we talk about medical aesthetics.
What do you think one of the biggest misconceptions is about the GLP-1s?
I would say the GLP-1s people see online, oh, it's going to cause you cancer. You're just going to gain the weight right back. Yes, there are risk factors for anything we consume. When you decide to go get Taco Bell, you are deciding to sign a line of potential for cancer. I think only 10% of Taco Bell's taco meat is actually meat, or is it 30%?
It's probably less than that.
It's very low for a food item that we're consuming. So no one ever questions those, products, so to speak. But the moment we start questioning things that are going to decrease our risk factors for long-term diseases, that's when I have to question you. What is your actual goal in life? If it's to live long, it's to have a quality of life where you don't have aches, pains, or taking 12 to 14 prescribed medications a day, then maybe we need to start discussing some weight loss regimens. And GLP-1s are going to help you decrease those risk factors, those long-term risk factors, and also increase your quality of life.
It helps with what? Appetite?
So it helps with appetite suppression. So I guess let's rewind. GLP-1s, we already naturally produce them. It's in our stomach every time we eat. So you go and you eat your meal or breakfast for the day, your body releases a GLP-1 hormone to let you know that you are full and you don't need to continue to eat. Okay? What ends up happening is we become desensitized to that GLP-1 naturally because we've become natural overeaters. Whether you're deciding, oh, I'm going to go on this fast today and I'm going to eat one meal a day, that's not beneficial to your body. Not only that, GLP-1s help with that insulin resistance. Insulin in our bloodstream is released to either store the fat or burn the fat, which would be your metabolism. So that's going to help you with that insulin recognition. Recognition. Yes.
You're making up words now. That's
I
cool.
am making up words. I told you I was tongue tied, so I said you had to get through good anatomy, medical aesthetics.
Good anatomy, medical
If I
aesthetics.
can, you have to.
For sure.
Okay. So where were we at with the GLP-1s benefits?
Yeah.
So the other benefit is it naturally burns that visceral fat.
The visceral fat.
Yes, that's around our organs. But that's when we have the GLP-1 with the GIP, and that's your tirzepatide.
Okay.
So that's the one that I'm more of an advocate for, because whether we're even on a workout plan, it's still going to help you burn that fat without you even doing anything. I do not encourage that whatsoever.
So the peptides, they just mimic what our body naturally does.
Right.
But they enhance it.
They enhance it.
'cause
So
there's
it's like, it's turning up the volume.
Yeah.
Realistically.
Growth hormone peptides, the GLP-1s and all that. So they're great. They're great for recovery. So you said you would recommend to a client doing the tirzepatide for the visceral fat?
Yeah, I recommend for the tirzepatide because it has fewer side effects. I've also taken GLP-1s. I've taken the semaglutide. I had the nausea, not so much the vomiting, but in the constipation. Those symptoms are perfectly normal. And I think that's the difference when you do come to me, because I am a provider. I'm going to follow you. I'm going to let you know what these side effects are so that you actually stay on the regimen. It's slowing down your gastric system initially. People always say, oh, well, isn't that bad for food to sit in my intestine for so long? Absolutely. But it's just an initial response to like anything so that your body can adapt to it. And once your body adapts to it, you will go back to normal. The nausea, the constipation will resolve realistically. And also remember that the GLP-1s with the GIP, not only is it burning off your fat, helping with your insulin resistance, helping you feel fuller longer, is now going to help you with that gut to brain notification, meaning that I'm full, I need to stop eating. It's also a neurological symptom. So meaning that, hey, I don't want to overeat. I am full. I don't crave bonbons or ice cream right now. Yeah. So that gut to brain signal that is, establishing is going to help you in the long term. And that's why the common thing that people say is, oh, well, you gain the weight right back if you're not on the proper dosage or titration plan. So a titration plan just essentially means that we start you slow so that your side effects are less. We slowly build you up until you get to that plateau where you want your weight loss. Then we titrate you down off of it. So we're not just ripping it from your body, the additional GLP-1, so you don't go back to which would be a rebound effect of overeating again.
Gotcha. So is there like a certain meal plan that you have for each patient when they do take the GLP-1s?
So I don't do specified meal plans because I'm not a nutritionist, but what I do is discuss food items or food groups that are going to help you long term. So not just your weight loss, but your fiber sources, your protein sources, vitamin sources that's going to help with skin, joints, nails, hair. Because it's another side effect that, GLP-1s do cause is hair loss. And I'm very transparent about that, but there are answers for that.
So do you tell them to take biotin? I know biotin.
Yes, you could take biotin, but also just making sure that you stay hydrated realistically and your protein. Those are going to be your biggest factor. So a lot of times that you're having this hair loss is because you're having a nutrient deficit because you're eating less.
Okay.
So
you need a supplement to make.
So you need to make sure that we're getting nutrient dense foods groups. So protein shakes are always like going to be paramount. Collagen, I love collagen with vitamin C. As long as we're getting those nutrients in and not just saying, oh, I'm not hungry, I'm not going to eat, then we're going to have fewer side effects.
That's great. You don't ever think you're going to offer IV therapy to kind of help with those deficiencies?
One day we'll do IV therapy. I'm not a huge advocate for IV therapy just because you could just drink your electrolytes. You could just drink your water.
Do you drink electrolytes every morning?
I don't. I want to start. So what I do drink every morning is chia seeds, water, and a squeeze of lemon. And that helps with my digestion and also helps me, I guess, stay fuller longer. Kind of also cuts down some cravings. And it's supposed to be good for your skin. So,
oh, really?
Yeah, I know. Does my skin look good?
It does. Do you ever fast yourself, or do you ever tell patients to intermediate fast or fast?
Okay. So here's the thing about fasting, and obviously it's worth doing more research on. But when we're fasting, yes, we are giving our digestive system a break, But what we're also doing is triggering a response in our body to store the food once we start eating again. Remember, your insulin either stores or burns. And now our body works on a feedback system. It remembers that time you decided not to feed us for 24 hours. So it's going off of that idea. So the moment you do eat, what's going to happen? You're not burning it.
But what if you eat just straight protein?
You have to have a balanced diet. You can't. We're not carnivores now.
No, I mean after you fast. Like if you just have a bunch of protein the first couple of days and then you get into carbs and
again, we are not carnivores. We are not. I don't even think we're even meant to eat meat in itself. If you think about, I'm gonna get really nerdy.
You're gonna go into conspiracies, which I love.
We're gonna have to get
Yes.
into your favorite diet. What you think is right?
My favorite diet, or what I think is right. I think protein should be, because what were we doing? The My Plate. I think they've changed the My Plate to the pyramid that's now upside down, but I'm going back to the My Plate. I think protein should be about 40%. Carbs, starchy carbs should be less than 10%. That's your rice, your potato. Yes, your rice and your potatoes, you do not need as much. And vegetables, a leafy green vegetable. That's going to give you your vitamin A's, your calcium. It's also going to give you some fiber to help push that protein through your digestive tract. Does that diet work for everyone?
No. It would never work for me.
No. What is it? The carbs?
No, it's like, where's the fat, man? I need some cheese.
The protein, you could eat a fatty steak or.
Yeah, but I need some cheese. I need some, like, you know what I mean? I need some fat.
That's why you got to cook your protein in butter.
I was going to say, so it just depends on what you're cooking your protein in. Or even you can cook some of your vegetables. You could wilt it a little bit using like your avocado oils. We know that those are good for your brain. Your brain is made up of fat. It wants fat, good fat. Nuts. You like nuts? That's a snack. But no, you don't need a whole bunch of grains or oils.
For sure, I agree. This is totally off topic with your business, but what do you think the biggest misconception about food? One of them is butter. Like everyone thinks butter is bad for you, and they eat fake butter.
I was gonna say that. So back when they were pushing I can't believe it's not butter. Now we're going back to you just need whole churned butter. So this is like, again, off topic. I took my son to a farm. Amish farm where we learned how to churn the butter, milk the cows. Like we did that hands-on. We made bread from scratch. If we think about the things that we were eating prior to these processed, I can't believe it's not butter. Those people that are eating those whole foods have less chronic conditions. Sure. And I've seen that firsthand. I'm now, because I've worked in the healthcare setting for quite some time, I'm now seeing such a shift in the age range of people with chronic conditions. So before you would have your 80 or 90-year-old patient, and yeah, obviously they have heart failure. Now we're talking about 40, 50-year-olds with heart failure, conditions that were not seen until you were well over the hill. Why?
And it's because all the processed foods, it causes inflammation.
Yes. So to go back to, it will be 100% better to use Irish butter than I can't believe it's not butter.
And it's simple because you can look at the back of it. Look at all the ingredients. Like when you get a fake meat burger, there's 50 ingredients. When you get a real hamburger, it's just beef.
Beef. That's all it says. 100% beef.
You want to eat 50 ingredients or one ingredient? It doesn't make sense. And they say if you can't pick it, catch it, or shoot it, then you shouldn't be eating it.
No, I agree with that 100%. The other shift that I've been doing when I go to Costco itself is, if you look at your package for your chicken, you want the air chilled chicken.
Yep.
Because the other chicken apparently is sitting in a vat of chlorine-like mixture with other chickens just soaking in the bath and also soaking in all those impurities.
Yep.
And that's what you're consuming. And then we wonder why we have all these chronic health conditions when we know a lot of health conditions originate in your gut.
Not only is it soaking in it, but they inject it as well. It makes it way more, so they make more money off of it.
Yeah.
It's a whole money racket. That's why I just go to Whole Foods. I get the air chilled chicken.
I do too. It's more money, but it's worth it. I think everything costs at this point. I stopped nitpicking. You know, you look at the packing like, oh, this one's $5.86, but do you have a $4.89 back there?
Yeah.
No, I just don't even look at prices anymore. Just as long as it's Whole Foods, you're the safest.
Let's get back to good anatomy. Why is facial anatomy so important for injections?
Well, the anatomy of your face, one, is different from you to you, realistically. So we need to know these anatomical structures, where your blood vessels lie, where your fat pads have now shifted or migrated because we've gotten older. We have to know these things so that we are mitigating any potential for side effects, and that being your vascular occlusions, but also it's going to give you the best results if we know exactly where your bone depth lies or what you're missing from your anatomy that's making that asymmetry not look as appealing. We know that if we inject filler right into our cheekbone, that's going to lift your cheek and give you a brighter effect. It's also going to help shift those shadows under your eyes so they don't appear as harsh. So knowing the anatomy of a person or just in general is going to help with the best results, realistically.
Do you have top safety rules that you use when treating clients?
So I will say, before you come, I always send the day before, and also, you know, this a week prior, what I expect from you from like a health standpoint. One, no drinking any alcohol within 24 hours of your appointment. And I really want you hydrating. I hear so many people go, oh, I don't like water. Our body's made up of 70% water. It likes you. So that will be like one of my safety protocols. I'm experienced. I'm a provider. There are safety protocols that I hold for myself just as a medical provider.
What about meditation? I got to ask, because I get all this stuff. What about the spiritual forces? Do you meditate? Do you believe in meditation?
I do believe in meditations, but not on how you would view meditation. So we think that it should be such a structured sitting, kumbaya, pinching your fingers. No, I meditated at least 4 or 5 times just being here and talking to you. And that can look like a mantra that I'm repeating in my head. Everything I want wants me too. So that's a form of meditation. When we're reciting these mantras or affirmations, you're meditating and maybe even praying.
For sure. Yeah. And when you focus on your body and you look more appealing and you feel better about yourself, you can look in the mirror, that strengthens your mental health. Mm-hmm. So that's one of the largest growing parts of the medical field. How do you feel about mental health since phones came out and all this stuff's been going on?
I think our mental health is fragmented, but the beauty about it, now that we have the resources to identify it, so it doesn't feel so, oh, am I the only one that's experiencing this? No, there's someone else that's also experiencing the inability to walk in a room and feel like all eyes are on you, and realistically, no one's paying you any attention. That's just a form of you being paranoid. So now we do have these phones. We can identify those little mental health issues that we may be dealing with. But then on the other flip of the coin, we have these access to, I guess, visuals of people living these grand lives and not realizing that life is kind of what they decided to post, right?
Yeah.
They're not showing you their real life. Everyone is dealing with some form of trauma. Everyone's dealing with some form of insecurity. So when we're seeing these constant visuals of people living these happy, carefree lives, it kind of displaces us. And we start, comparing our lives to another individual's without really doing the work to improve upon.
So that's a very common stereotype about the world now. Everyone's comparing themselves to someone else on social media, right? Mm-hmm. Do you see women do that a lot? Come in and say, hey, I want to look like Kim Kardashian. I don't know, right?
Yes, absolutely.
Go ahead.
So it's so easy for us to look at a visual, and this could be a form of a vision board, But when it becomes a fixation, if you think that, oh, if I had fuller lips, then I'm going to attract the man that I want, and now my life is going to be carefree. No. That is a form of, like, you probably need therapy versus you needing lip filler.
Why do you say it like that? Because beauty to a woman means a lot, and we'll get into that. But why do you say they need some sort of therapy? Just because they want to be mimicking someone like on social media?
Because then they're not staying true to themselves. They're not looking at themselves in a light that is going to produce any level of positivity. It's always going to be, what's the next fix? Who can I, consume myself with to look like? I'm going to be, a version of them. That's not a version of yourself. That's not going to help you achieve your goals. That's not going to help you ever be comfortable within your skin. So I would say that finding a therapist and talking through these insecurities, identifying why you have these insecurities, and kind of reigniting your own light would be more beneficial than getting any type of beautifying procedure.
Do you sometimes feel like a therapist because you're with them? And do you kind of sometimes feel like a therapist?
So I think that in an alternate life, I probably was a therapist. I'm the person that my family comes to discuss, like, oh, I'm pissed off at such and such. And I'm, giving them a level viewpoint, a different perspective, or they're feeling down about, maybe a failure. So that's the same for my patients when they come and they sit in my chair. We are discussing everything. And when I say everything, I want to know, like, your stress levels. I even want to know your dating history. I know that sounds kind of a little creepy, but I think that this is who you date is a reflection of who you are or who you see yourself as. So I do ask you that because you might be going through a divorce. You might be under your husband's cheating on you. So that's also going to influence this change, so to speak. So I think that knowing these things about patients and being their therapist is beneficial to them in the long run. So we go a little bit further beyond just changing what we see on the outside, but also our mental health is going to play a key role. Because even then, once I fix whatever insecurities you have, if your mind or your thought processes are not aligned, then you're always going to see yourself as, needing a fix.
So beauty, why is it so important to a woman?
Why do I think it's important to a woman?
I think that's a good question because you are the expert here.
I would say beauty is a construct to keep us competitive for mating reasons, if we want to take it real primal. So
that's it?
That is it.
Are you sure? You just said look good, feel good, perform well.
Okay. So you're asking me why do I think women come and they want to feel beautiful?
Yes.
That's why. I think it's a primal instinct because we want to compete with the next woman for mating reasons. Do I think that we can look at beauty from a different perspective and utilize it to, improve our mental health, improve our overall well-being? 100%. Like I said, when you look in the mirror and you're seeing tired and overwhelmed, those reinforces those feelings. If we're looking in the mirror, we see restored and refreshed and glowing, that's going to reinforce those positive feelings. So beauty can change. It just takes a paradigm shift.
Do you deal with a lot of clients that come in that have gotten work somewhere else and they weren't happy with it?
No, surprisingly. I've only had one patient so far that I looked at her and I said, hey, what do you see? She was the overfilled lips, I want to call it a crimson chin. And I think in her mind, yes, the crimson chin. I think in her mind, she went with an image of, oh, well, this person had a facial rebalancing, jawline contouring. I want the same thing. But realistically, her anatomy did not cover for that. She already had a strong chin. So why would we add to that? And it was clear that the injector did it for the profit versus the actual results and what was best for that individual patient.
So it's good you kind of get personable with everyone.
Yes.
I feel like that's where a lot of other med spas make mistakes.
Yes.
I know you wanted to touch on, before we wrap up, I know you wanted to touch on a few key points yourself Did we cover everything, or did you want to get into anything else?
And I got some fun questions.
You have fun questions?
Because whether you know it or not, Dariah is actually pretty funny. So I have some fun questions for her.
I am funny.
I'm not sure what to think about that.
I have some great questions.
Have you seen these questions?
I haven't.
You haven't seen these questions?
No, these are questions that come from the moon. They come from outer space. They land here.
Now we talk about peptides, GLP-1s, whole birds. Yep, we got it all.
All right. Are you ready, Dariah?
As ready as I'm ever
All
going
right.
to be.
Would you rather be broke and ugly or wealthy and beautiful? Excuse me. Wait, other way around.
Yeah, start over.
Would you rather be broke but beautiful or wealthy but ugly?
That's a hard one. What's wrong with you? Did you come up with this?
I just came up with it. Thinking to myself.
Broke and beautiful.
Or what do you
Wealthy.
think? Yeah.
I would rather be wealthy and ugly.
Really?
Yeah.
Now here's another question.
Because you can't really define ugly. There's no
That's
definition.
what
No,
it
yes,
was.
you can. You can define
that's
ugly.
what it was. I'm going to be, so beauty is one in the eye of the beholder, but two, beauty is how you feel about yourself. I want to give an analogy without offending someone.
Can you just say the analogy and then we'll decide if I got to cut it out or something?
Okay. So someone's spirit can be ugly, which makes them ugly,
1,000%.
But they're really beautiful.
but they're really beautiful.
Yeah.
And then someone,
That's
so to
less
speak,
attractive.
less attractive can be seen as beautiful because their spirit is beautiful. Whoopi Goldberg.
That's a good
Can we
analogy.
pan to their faces? Whoopi Goldberg.
Okay, so here's another question. So can you buy beauty? Let's say I have 10 billion for my wife, but she's the ugliest person on the planet.
I could say you could buy a beauty standard.
Okay.
100%.
Plastic surgery.
Plastic surgery, facial enhancements. There's been women who look completely different from in their 20s to in their 30s that we know that are on covers of magazines. Okay, so yes, you can buy a beauty standard. But again, it depends on how we're looking at beauty.
Yeah.
Is it a mental or is it a physical feature?
Well, it's partially both. Like you said, the spiritual aspect is very important.
Okay, I have a question for you.
Sure.
How common do you think you see people who are beautiful in spirit? How often do you look at people's spirit as beauty versus
more
their physical?
often. Much more often.
Are you saying that because I'm in front of you?
No, honestly, because nowadays I feel like my generation is suffering with what you see is what there is, right? And I'm going against that tide because we just had David Cooley on the podcast too. And the dating marketplace has changed completely. It's now said that 90% of women are looking for 5% of men. What do you think about that?
So we're dealing with a ratio of a 1 to 5 right now. That means for every one man, there's 5 females currently. Is that correct?
And that's the top. That's what women are looking for, let's say.
No, what I'm telling you right now is very hard for women to even have a preference realistically because they're competing with 4 other women for one male. So when we think about that, I think the dating world is kind of screwed because now we flipped from, like, I went on a date recently and the guy just recited all his preferences. And I'm looking at this guy like, what makes you think you could have pick of the litter? There's no way you could have pick of the litter. Do you see yourself? But because we're dealing with a ratio of 1 to 5, he absolutely can. And women are kind of lessening themselves to fit a certain criteria to meet that male's preference from what I see. How often are we seeing men, as cheesy as it sounds, with boom boxes, delivering flowers, pining for a woman's affection? They're not.
No, not anymore.
Why?
Social media.
Social media and ratios.
Supply and demand.
Supply and demand. And then there's some women who've just opt out of that whole rat race or competition, so to speak. And I guess the dating world also suffers from that because they could be of quality women.
So here's another interesting question. So it said men become more valuable when they get older, right? Because they get more money, they get more power, their businesses succeed, whatever. What about women? What is the age you're seeing at good anatomy, medical aesthetics? What is the age drop you see where women start to lose it a little bit more?
Lose it?
The beauty.
We're back at this beauty word. Again, beauty is your standard. It can be a mindset. So I don't think that I'm seeing so much as women's beauty dropping, but real life, anatomy is changing on your face, which again, we have those under eyes, sunken under eyes, skin's not as glowy, it's not as plump. So it does change your spirit for some women. Some women, it does not. So I will say that around your 40 or 50 age range is where you start seeing women looking for those corrective procedures, correcting those under eye hollows, rejuvenating their skin, getting facial balancing. So that around that age range, but I don't think they lost it. Okay. I would never say lost it. I just think that they are aging, and that is just the normal process.
So before we wrap up, what are some big goals, or what's your big vision for Good Anatomy in the next couple of years?
I like that question. So I think I have to stop saying I think. I have to start saying I know. We have to start affirming. Mm-hmm. So I know that Good Anatomy is going to have a impact on the medical aesthetic industry just because we are treating patients in a whole body care model. But also we're putting wellness as the heart of what we do so that whoever comes to us is feeling whole again when they leave us. They're not just getting one procedure, they're getting I guess you would say a restoration on their life. So we're restoring their facial balancing, we're improving their health, whether it's weight loss, and we're also reigniting their spirit. So that's the impact that we're going to have for Good Anatomy and for the medical aesthetics industry. That's
great. So where can anyone listening find you at?
So we are located in the beautiful borough of Emmaus. So we're right on the main avenue by the McDonald's on Chestnut Street.
That's a good location. Off Cedar Crest?
Yes. I think that will allow for, I think it's a nice focal area for the Lehigh Valley. So whether you're coming from Allentown, Bethlehem, Easton, or if you're coming even from the Quakertown areas, you're able to, we're accessible.
That's great. So thank you for coming on the podcast, Dariah.
Thank you so much.
It was a great pod.
Yes.
I appreciate it.
Thank you.
Thank you.